Dear friends, today we have successfully finished one case of yeah. Today is Saturday, 25th June 2022. This is our 809 case of Puberphonia. So today the regular class we like to give more information about EULA. So last Saturday we have come to a level where you will direct the sound wave to the mouth. Our research is, our finding is, you will direct the sound energy filled air to the nose. So you will only direct the sound energy air to the nose. Important in producing the head voice or resonating voice. So the resonating voice is the result of air entering into the nose and then the air goes to the sinus. That is the important thing. How it goes to the sinus is Bernoulli's phenomenon. This is clearly told by many scientists, but how it goes to the sinus is our opinion on our message to you. How this Bernoulli's phenomenon acts there. One day, while attending a small seminar in Dr. M.G.R. Janaki Medical College, our present DGP, Jalendra Babu, Honorable respected DGP, asked all the students how airplane fly, take off. If you answer, he is asking the students, I'll give you a present. So many people, many students, interested people told because of the speed, because of the structure and everything. Dr. Dalendra Babu insisted what is the real mechanism behind it? How the flight take off? He clearly told it is Bernoulli's phenomenon. That means air is divided by the wings of the flight, below and above. So, two air is coming in only one direction. When the propeller acts, air is going up and down, above the flight, above the wings of the flight, and below the wings of the flight. Below the wings is very important. The whole thing is a funnel shape. So a negative pressure is created there. So because of the negative pressure, automatically, even how much weight of the flight, it is lifted from the ground. That is called Bernoulli's effect. When air passes through a narrow orifice, negative pressure is created. This is explained by many people. We also used to explain how vocal cord comes together when air escape from the trachea to the pharynx. So from the trachea, air, when we speak, it goes under the vocal cord. Then it goes to the above the vocal cord, then to the pharynx. When it moves, a negative pressure is created, so vocal cord meets together. That's all. Similarly, in the nose also, the air goes from the nasopharynx to the nose. The air goes by the pushing effect of or directing effect of uvula. When the air reaches under the turbinates, there are three turbinates on each side of the nose. Turbinates are nothing but similar to the wings of the flight. That is what I imagine. So the wings, the turbinate, I call as wings, இறகுகள். The wings, underneath the wings, the air goes. So where it goes, underneath the turbinate, underneath the wings, turbinates in the nose, மூக்கின் உள்ளே உள்ள தடுப்பெலும்புகள். When it goes underneath the nose, the pressure is increased. So thereby orifices are there in the meatus, under the turbinate, under the wings of the nose, holes are there. That holes are opening for the sinuses. So pressure is more, it goes into the air goes into the sinus. Speaking air is different. That is, speaking air means it is loaded with sound energy that is created by the vocal cord. So in the vocal cord, only sound energy is produced, not words. So uvula only open and close the holes of the nose and sinuses. So air enter into the sinus, maybe maxillary more, ethmoid another, sphenoid and frontal at least, but still air goes inside. Maxillary sinus, ethmoid sinus, frontal sinus, sphenoid sinus, these sinus are situated under the brain, parallel to the nose on each side, which actually contain air. When air goes in a mass, a cul-de-sac is formed. So air slowly, once again, it can escape through the orifices. Here is the main thing happen in the name of physiology. Mutated effect forms. Mutation. So a mute effect is formed. This mute effect, lot of machine you may have seen or heard about mute effect. So the mute effect make the resonance. That is resonance is similar to snoring or coughing. That voice is not created by vocal cord. Coughing, hello. So these sort of words are a resonating sound that is called low pitch sound. These low pitch sounds are created in the sinuses. So, the main important point we want to emphasize is uvula is a major organ which we have to initiate in treatment of puberphonia. Just listen to me. Hello, Nalakia. That means it is generating the vocal cord. Hello, Nalakia. Here you are having a head voice which is directed or initiated or created by the uvula. Our research also in puberphonia, what happens is uvula become inactive. So uvula feels we are having no action. Uvula is mutated. Uvula had a stop event. Mutation can occur in any organ. Similarly, a stop action. The stop action is well explained by a previous scientist. So this may be due to a habit or generation or how it is brought. So all these things are already explained and proved. Few organs can become mutated. Here, uvula become mutated in speech. This is in terms of development or adulthood formation or sex maturity. So this is almost linked with sexual maturity. So many people are giving lot of explanation how this stop effect and mutated effect can become. Then little it will change to learned disease. We learned. See, some of the phenomenon, some of the disease are learned disease. Even Valino Ramachandran, the neuroscientist of the world in California, he also explained in phantom pain the learned disease. It is a learned disease. It is a learned problem. It is not there. It is a learned. Treatment is unlearn it. So here we are bringing out the same theory. Uvula become inactive. It is a learned problem. It is not a problem, but it is a learned. So the treatment is unlearn it. So unlearn is you have to cheat the brain or cheat the neurophysiology, synesthesia. One small example I just want to tell. Mother had an accident, head injury. So the son dashes and come and see the mother in the hospital. Mummy, how do you feel? Mummy is in a confusion stage. She tell, you're not my son. I'm not, by seeing you, I'm not recognizing my dear boy. I'm not your son. Mother, this boy goes to the next room and had a telephone conversation with the lady. So this telephone conversation She called the mother by phone, and the mother immediately recognized it. Oh, you are my son. Where you are now? Come and see me. I had a head accident, head injury. Come. So phone calls is able to understand, but direct seeing she is not able to understand. The appearance by appearance does not recognize the son. This can occur for all person in so many times. Oh, somebody if you பார்த்த மாதிரி இருக்குதே. This can happen. So the same, it is a learned disease. You have treatment is unlearn it. So in puberphonia, the organ mutated is uvula. Organ had stopped its action. It became a learned disease. So why the organ has stopped learning? That may be due to not stop learning. There is a break of voice should happen when a boy becomes adult. That doesn't happen in puberphonia. Everybody knows before maturity, boys and girls are having same high pitch voice. In boys, voice break. So if it doesn't break, then only the high pitch voice continue, and we call as puberphonic voice. It may be childish voice or female voice. So these things are, so now our treatment, our research, our finding of treating more than 900 cases of puberphonia. This is 9 years work. We found the culprit is uvula. Then my search goes, what happened to the uvula? Really, the uvula is damaged. Uvula have become inactive. Uvula learned a disease that we should not act. Because all over the world, every ENT surgeon know, when you cough, when you yawn, when you snore, the puberphonic fellow can have low pitch voice. So my intention, I have already told you, one boy, small boy of 7 years snoring, mother told, this boy is snoring like an adult male. The voice is an adult male. So if you make a person snore, cough, or yawn, you can get a low pitch in a high pitch patient. So here the active principle should be uvula. That is what in my mind it came. So we have to correct the uvula, activate the uvula, and we succeeded. Vocal cord is not the organ to treat for puberphonia. But there are a lot of theories put forward. Vocal cord is the disease place in puberphonia because it increases the length in adults, and the position also it lowers, and the air pressure below the vocal cord, above the vocal cord, how the vibration occur. There are a lot of very good research work was there in the vocal cord, glottic, subglottic, and over the vocal cord. That is why throughout the world, all are doing some treatment, whether manual therapy or speech therapy or surgical treatment like phonosurgery on the larynx, on the vocal cord. But on the vocal cord, if you want to do a surgery, it is a little, it is not a, it is a good surgery. But whatever may be, it is a small mutating, a thyroplasty, even vocal cord lengthening or shortening or thyroid cartilage cutting or releasing and lowering in the name of thyroplasty. So some changes you have to do in the vocal cord. There are very good report that changes the pitch. But my feeling is, I thought the problem is not in the vocal cord, the problem is in the uvula. So I was going on searching what happened to the uvula and what is the remedy required. Uvula, anak. There are two differences between, there are a lot of, basically two difference between animal and human being. Animal is not able to speak, make noise, but can imitate some sound. Basically, Sargamabodhanisa is a creation only. But proper speech is not there in animal. But in human being, speech is there. A legible speech is there. And the very important thing strike to me is animal is not having uvula, human beings are having uvula. How a great point. I've done so many studies. There is reliable literature. Animal is not having uvula at all. But in some monkey group, a rudimentary uvula only they have seen, but no developed uvula in animals or birds. Human beings are having uvula, and that may be a great thing for production of speech. My mind goes. Then I have gone through all the old literature. What happened to the uvula? Is it a vestigial organ? Yes. Is our knowledge of ENT surgeon, and while we are reading also, we thought the uvula is a vestigial organ. Vestigial organ may be just like appendix, you know that very well. There is no specific reason why you are having uvula. So uvula also, just like appendix, you know, appendix can give problem, but no important. You can cut it and throw it away. Similarly, uvula also you can cut it and throw it away. We used to treat snoring, cutting the uvula. Many cases. That may be the culprit for producing snoring. Snoring and sleep apnea. Night time you forget to breathe and you'll become suffocated. Few person die even. So that may be the origin, that may be the reason for uvula. So it is a இது ஒரு புதிர். Uvula is a புதிர். So you can cut the uvula. Nothing will happen. In snoring, we used to cut the uvula to relieve snoring, and nothing will happen to the voice. There may be initially some problem, later it develops. So, function of the uvula is it secretes saliva. Thereby, the dryness of the mouth is prevented. But our feeling is not only it secretes saliva, it is a speech organ. It is an auxiliary speech organ. Olden days literature, what happened to the uvula? Old literature says uvula is a dangerous organ. It causes sudden death syndrome in children. Even now, in certain countries, as soon as the child is born, they used to remove the uvula because it may cause one of the symptoms called as sudden death syndrome in children by suffocating. Yes, we know in adult who snores, sleep apnea can cause even death. But contrary to that, there was a history how to live long without taking food is you insert the tongue into the nasopharynx. So that is a mutra is there. Even without taking food, without taking water, you can live long. How mean insert the tongue into the nasopharynx. And the uvula, microscopically, I have studied in many cases. A good muscle is called as muscularis uvula. That is very important in drinking water. Say how you drink water, that is different from animals. Animals drink water by bending, but we pour water by extending the neck. But if you are having dysphagia or paralysis of the esophagus, you have to bend down and use a straw and take water. Then only the water won't go to the tracheobronchial tree. If it enter the water, enter the tracheobronchial tree, mean you will have suffocation. So that is phylogenetically also important. Man first lived like animals only. He should have been walked with hands and leg, and he should have been staying in the trees by night, just like other animals. So they want to escape from the wild animal. So human beings slept in the tree branches only. But when he is able to construct a protection, a four-walled house and fire, he landed down and he was able to sleep on the floor, not on the tree. That phylogenetically and so many things happen. How a human being performs sex by bending or straight. So many theories are there. So all these things had gone into my mind. Even now, also, the best thing for good voice is put out your tongue and shout out. And the beginning of speech, first voice is babbling. The first voice in a child is babbling. So these are babbling means, that when you learn swimming, you go to the water and catch hold of the uh, parapet wall, take mouthful of water and blow it out when you come out. The same thing, the babbling effect, the child do when it started speaking. So these are the phylogenetically it comes. So uvula, we have dissected the muscularis uvulae, which is a sophisticated structure, and it is having serous and submucous glands, which are all absent in mammals. In human being, lot of submucous and serous glands there in the uvula. I had a lot of experience in dissecting animals when even 40 years back, we are searching rhinospodiosis in the nose and orocoitis. So many animals, even rat, rabbits, and those living in water, cows, fish, we have operated and seen. So that experience had helped me now also in finding out the structure of the uvula. Today, I want to emphasize to you both uvula and speech serve to differentiate human being from animals. Our conclusion is uvula is possibly an auxiliary speech organ. Maybe another marker for human evolution in differentiating man from other mammals. Here, our research goes on more deeper about uvula, and our research on English literature about the uvula is very, very minimal. We are not able to find out more information about uvula in English literature. In Tamil literature, lot of reference on uvula is available. There are 63 Nayanmars, 18 Siddhas, 12 ஆழ்வார்கள். நாயன்மார், சித்தர்கள், ஆழ்வார்கள், இவர்களது அனைத்து லிட்ரேச்சர்லையும் these நாயன்மார் and ஆழ்வார்கள், everyone describe about அண்ணாக்கு, uvula. That I have read so many times. So that only helped me to explain and help me to go forward how uvula is proving itself as a auxiliary organ of speech. I cannot forget definitely the Nayanmars, Siddhar and Alvars, especially Nammalvar, Tirumular, and Ahatyar, Patanjali, Horokar, Karurar, Vohar, Pambati Chittar, and so to say, I am more interested in knowing about Sundarar and King Cheraman Perumal. They are all very big people. Very big people means godly people. They are having direct connection with the God. They talk to him. Sundarar and King Cheraman Perumal. Along with them only, Avayar go to the highest place to meet the God, Shiva. Even though it may look like a little miracle, and but it had happened. These people are having direct contact with the God. Then that is why our language had become a great godly language. I cannot wait. We do research on Puberphonia. I cannot forget about 63 9 Mars, 18 Siddhars, and 12 Alvars. Even now, more 9 Mars, Siddhar, Alvar may be there. They will be with us hidden. So, next Saturday we'll meet and we'll continue the topic in a more spiritual way, and that may be helpful for us to go further. Thanking you. Great.